thrush in women, causes, symptoms and treatments. Yeast-like Candida fungi are found in every human body, but their number should be normal. If the number of fungi has gone beyond the established norm, a woman may feel some discomfort, which is typical for such a type of disease as thrush. The most common causes of thrush are the use of panty liners, synthetic underwear, non-compliance with the rules of intimate hygiene, metabolic disorders in the body, as well as taking antibiotics or COCs. Symptoms of candidiasis. The main symptoms of thrush are the presence of itching, burning and discomfort in the vaginal area. This is due to damage to the mucous membrane of the external genital organs and is accompanied by white or yellowish curd discharge, as well as an unpleasant sour smell. Pay special attention if thrush is accompanied by pain or burning during sex or urination. To confirm the presence of the disease, we recommend visiting a gynecologist, who will not only determine the form and degree of the problem, but also prescribe the treatment of the disease. What types of candidiasis are? Vaginal candidiasis is of two types, acute and chronic. Acute, in turn, lasts more than 2 months, and chronic is divided into two more subspecies, recurrent and persistent candidiasis. Recurrent is considered a special variant of the course of a chronic disease, which is characterized by more than 4 episodes per year. The most severe form of thrush is persistent candidiasis, in which the symptoms of the disease appear constantly, but have varying degrees of severity. Ways to treat candidiasis. If you notice one of the above symptoms, most likely you have thrush. Therefore, it is not necessary to postpone examination and treatment indefinitely. Therapy for thrush should be systemic and consistent, otherwise there is a chance to relieve the symptoms, but not solve the problem. Complex treatment implies the use of antifungal drugs, as well as drugs that normalize the vaginal flora. Depending on the company and the drugs prescribed by your doctor, antifungal drugs are available in the form of tablets, capsules, suppositories, ointments and creams. However, you should not resort to self-treatment. It is better to contact a specialist for an internal consultation.